Please help me welcome Deborah Kibbe.
Thank you very much. So I want to thank the organizing committee. I feel privileged to be here. I'm passionate about childhood obesity. I grew up in a town of 600. I am passionate about rural health. And most importantly, I'm passionate about the fact that I have talked to people today from the age of 15 to 80. Because in order to address childhood obesity, we need to keep going. We need continuous effort for more than 20 years. And I'm in about my 20th year of this work. And so it took us about 40 years to address smoking, and we're going to need all of that time to take this on. And you heard Dr. Neiman's talk earlier today, and if you were in the talk about the GROW program, I want to make one point. There is no other condition that affects so many children as obesity. Not cancer, not asthma, not ADHD, none of it. So the work that you're embarking on here in Oregon to address childhood obesity is crucial to the health of these kids. And it's crucial to your health as well. And because you've been sitting all day, and I loathe coming to a childhood obesity conference where you sit all day, you are going to stand up. You are now a third grade classroom. Good afternoon, class. Let's try that again. Good afternoon, class. Move away from your chairs, please, and start marching. Lift those knees up. Remember, you're third grade. Here we go. I'm going to give you a multiplication factor. You're going to jump rope the answer. If you have knee issues, march. If you're pregnant, march. Sorry, ladies, I didn't give you the sports bra notice, but here we go. 2 times 2, jump rope, go. 1, 2, 3, 4, march. Excellent. Everybody gets the idea now, right? All right, 1 times 4, go. 1, 2, 3. Thank you for counting out loud. I appreciate it. I'm not going to do 2 times 50. You will not need oxygen. Here we go. 3 times 4, go. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Excellent. Everybody's breathing hard. You're in your moderate mode. Now I want you to do cross jump ropes for me and back jump ropes together. 2 times 5, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Excellent. March. Everybody take a deep breath. Step side to side. Exhale. Deep breath. Exhale. Give yourselves a hand.
All right, what do we got?
Just came in. Heart attack. 5'9", 300 pounds, 32 years old.
How the hell does that happen?
Can I get a, Could be developing diabetes. You have to make a change. Oh, yeah.
You're graduating! Watch TV. You won't even have to leave.
You can't do this.
Yes, can I get a...
Yeah, no, deep dish.
You have to make a change. Good job, Jim. You got an A+.
Here are your fries, sweetie.
I still can't believe you give this child French fries.
I know, but it's the only thing that'll make him stop.
So why did I show you this video? It's not about fat shaming. It's It's not intended to talk about how parents can be bad at teaching their kids how to eat healthy. It's to show you that every system that impacts a child's life, beginning very early, makes decisions that will then lead to these health consequences in adulthood. Which is why today we're going to be focusing on a systems approach. So I'd like to take a little poll. You've heard a lot about what's happening with regard to weight gain in children and overweight and obesity. How many of you would say that the quantity of daily energy surplus, too much calories or not enough activity, associated with weight gain in children is about this much? That they're either over-consuming or under-activity-ing. I just made up a new word, bear with me. Is this, or this? How many would you say it's one? You think kids are out of balance about 200 to 290? 2. Oh, come on, commit. Raise your hands high. No one's going to write it down. Number 3. 4. This is good. Because what you've just learned is that what you have in store is much easier than you thought. For most kids in that 2 to 12 age range, getting them to balance is not going to be about a third of a meal. It's going to be about 3/4 of a Coke, a slice of bread, a half of one of the high-fat, high-calorie muffins, right? As David said earlier, it's possible to do different. But where we're really struggling, where he pointed out, which is really important, is the overconsumption that's happening in children who are carrying extra weight. We cannot possibly overcome 600 calories a day with physical activity. Kids would never sit on that treadmill, right, for an hour and 15 minutes at a vigorous level to burn that many calories. When you look at the work that's been done at Baylor, looking at Hispanic children who have gained 13 pounds in a year, considering their physical activity, it doesn't take much to take kids out of balance, does it? So as we think about what's going to happen, we heard about the WHO report. We've heard today about some great examples of work that fit within these categories. And one of the things I hope you do as a group working together to address childhood obesity is to look at all the things you've heard about today, about the GROW program, who've worked with both families and in schools. And they know their data now. They know their obesity prevalence data. They know what families have said in focus groups. And look at the strategies that are in this report and the recommendations and say, how do we take what we already know from the work that's been done here and further it using the recommendations here? So what did you learn today? You heard about cooking with kids. You heard about food as medicine. You heard about pediatric obesity and chronic disease and creating a culture of health through the school setting with representatives from major systems serving children. Department of Education, Department of Health, Boys and Girls Clubs, health systems. You have all the right people in the room. You heard Dr. Neiman talk about what needs to be done and where we are, where we're starting from. We have a good baseline. We have a good science base. But now we need to take what you're currently doing and ramp it up. Right? So if you were in the school garden session that I was in, and I asked Rick, are you still here? No. He's hiding. He doesn't want to. And I said, Rick, what was the question I asked you?
I got a lot of questions, to be honest.
So the question I asked you was, what's the data? Right? What's the data? How do we know that the school gardens or farm to school is having an impact? And we know that it is, right? But how do we know? And who are we telling about what we know? Right? So if you're at a table with just 2 of you, I'm going to encourage you to move to another table. And I want you to be with people you don't know. People who aren't in your organization. So go ahead If you're just with a couple of people, just stand up and shift to another table quickly. If you can hear my voice, clap once. If you can hear my voice, clap twice. You'd make excellent kindergartners. Everybody is now at their table. So here we go. What I want you to talk about is what you heard today, right, in terms of the evidence of impact, even if it was anecdotal, right? If you heard something in that culture of health session that said this will make a difference in our kids, not just BMI or childhood obesity prevalence, but other things. And I want you to talk about knowledge change or awareness building or behavior change, right? Skill building, BMI change, attitudes, cost savings, any evidence that you heard about today. Does that make sense? So even if it's anecdotal, right? There was not a published study on the slide, or you took a note about something, but you didn't really see if it was actually an evidence-based practice, right? Or someone shared a story about what they're doing in their part of Oregon. And I want you to document it. I want you to write down what you heard. And there should be someone at each table who becomes the writer. And if you volunteer to be the writer, you're also the reporter. And Rich, you're giving huge bonuses to people who volunteer, right? Okay. Okay. So you're going to have, right now, you're going to have 7 minutes to just brain dump all this stuff that you heard. And we're going to use this information in just a few minutes. Is everyone ready? Go ahead. Get that evidence down. Everything that you heard, that you learned, all that data. All right, we're going to document in real time. Okay, when you thought about the Cooking with Kids presentation, you heard from 2 medical students. Someday I, too, would like to present in a white lab coat. I think that's awesome. And the fact that those medical students, I've been doing research in childhood obesity with healthcare professionals since 1999, and the fact that they're doing lifestyle medicine, I think is fabulous. So when you think about getting the work that they've been doing, what did you take away from what they said? Or what didn't you take away? What was missing? Yeah.
So our group decided that what they took away from it was that the children were engaged. The behavior was hands-on and it made changes in the home. And the children were making the food themselves at home. So I get that the food that they offered or the recipes were very simple, easy to remember, and good, or they wouldn't recreate them.
So, yeah, go ahead.
When you bring it, they will eat.
When you bring it, they will eat.
And what you bring, they will eat. Exactly. No matter what you bring. No matter.
Okay?
It's kind of like locust.
Now, to further that work, what would you tell those medical students they could do to expand that work? What other things could they explore the next time that they run that pilot?
Family nights.
Okay? Yes?
Culturally friendly recipes.
And what else? Yes?
Build physical activity into their program.
There you go.
No choice, right? And when you make it about, you might even figure it out so it's about balance, right? How many jump ropes do you have to do to burn off that pea versus burning off what? That Cheeto, right? Because starting that young with 10-year-olds, they get it, right? That's simple math. And they do get it. Okay, let's go on to farm to school. We heard about farm to school and school gardens in the same. What was great about that? 600 plus? I can tell you right now that you're doing much better than Georgia, Alabama, Mississippi, Tennessee, and Texas. Okay, I do know that. All right, so farm to school. I heard some evidence of impact. What was it? Kids who participate, you said it.
Retain the lessons. retain their lessons much longer.
And those lessons could be integrated with academic content, right? Math.
Let me clarify that. They are, at least in Lebanon, what's a cubic foot? Let's measure cubic foot. Let's measure a linear foot. They get that from almost day one. And we teach K through 8.
Which is important for the buy-in, right? What else?
Well, one of the things that impact was, what Rick said was, when one of the schools found out they were the 500th, that made them go even further. So it was impacting other schools.
Okay. So being a special, right? Some recognition, that idea, and then expanding that work. You also, the other thing that I thought was fascinating is the number of partners that you mentioned as you were going through the pictures, Rick, right? So there were families that were, geez, we got ceramic stuff and art pieces and raised beds and, right? So all these different partners were coming together. These are not things that you're going to see in the obesity model, right? These are the co-benefits of all this stuff. And so you, future folks in the room who are medical students, document that stuff because that's what your policymakers care about. David and I can stand up here and talk about childhood obesity statistics, but these testimonials mean something. And when you write it, handwrite it, or you go in person and you tell them that, it means even more. All right, so I'm going to join that. Anything else about the school gardens and other tables, farm to school or school gardens? Yes?
If kids are involved in growing their own food, they're more likely to want to try it and eat it.
Which is critical, right? What we know a lot of kids are missing variety in their diet, right? And low variety diet means brain development is compromised, right? When kids aren't eating those colors, right? Not getting the fiber, all these things, we're compromising them, right? Okay, let's go on. What about the chronic disease risk? What actions did you hear in there? What things, what strategies that you heard you'd like to see more action on? Okay, what else? Anything else? What about you healthcare professionals in the room? What does it mean for you?
They're making the patients aware, the parents aware what the risks are.
And the risks that they're going to get diabetes in 25 years may not be the right risk, right? What are the risks that parents care about in the short term? Right now, what is it?
Won't be able to play with your kids.
For the parents to get there and play with the kids, but peer acceptance and doing well in school. And we have close to sufficient evidence. We know about the peer acceptance. Al Stunkard and many others have done that work. But the idea around doing well in school, we're getting that database, right? We're getting some evidence around this idea of vigorous physical activity, improving particularly acute math skills, and then kids who are eating healthy, we've known that for a lot longer, right? That's why we have the school nutrition, school breakfast program. Kids' brains need those nutrients in the morning, right? Quality food. So as we think about awareness, we also have to be mindful that part of what we know from school lunch and school breakfast is kids who eat them eat better. They get more variety, they get better nutrients. And so if you're one of those folks that have poo-pooed school nutrition, go eat a school meal, right? Because we need you to be supportive of that environment, that system that's feeding many of our children. Okay, let's talk about GROW. What do you guys want folks to know about GROW? If you're going to take it bigger, make it larger, what would you want to do? What would you want to do next?
Are you asking?
I am.
Oh, okay. I was actually curious to hear what other people
Okay. You want us to wait then?
I know what I think. I'd be curious to see how other people,
All right.
what they heard from us.
You heard some great data. Yes.
So I would love to see their next step to take their data and all of their studies and take it to legislation.
Okay. What would that mean? Like what legislation would result Can you say more about it? Can you think through that?
So I would love for them to take that and show policymakers that evidence so that changes can be made and these things that we are all totally believing in can start being seen. You know, changes in school culture, seeing things, more things offered in the community because of work like that they're doing. Okay.
So when you think about the Creating Culture of Health session and the House bill that you talked about, you have data from this to inform, right, why it's a good idea to get these physical education minutes, right? You want to say anything else?
So I would say that I think most important would be to try to have more of these opportunities where we can identify sectors of sort of congruent priorities so that the data, we can actually take the data and implement changes. And for those of you who didn't make it to our session, it was talking about obesity prevalence. We have longitudinal data over 3 years now in Oregon elementary schools. The most recent year and physical activity woefully low in school settings. And and then how do we make the case that this House bill that's been passed, but for which there is it's an unfunded mandate with, as far as we can tell, no teeth. And so it might be easy to say, well, we're not going to prioritize that. So how can we be creative in helping schools meet the gap and address this issue? Schools can't do it alone, so we need to take that whole of schools, whole of community approach to work collaboratively. And so I would like to see, developing partnerships and not replicating efforts, leveraging efforts.
Or replicating efforts that have had good initial results, right? So you can get even better.
Well, I guess not replicating concurrently.
Right, without collaboration, right. So the designs are, right? Okay. All right, anything you want to add about the Culture of Health session, right? Focusing on schools. You have a Department of Education representative who's in school nutrition, working on the Chronic Disease Prevention Initiative in Oregon, 1305 funding from CDC, a great mesh, right? So what did you learn from the Culture of Health? How are we going to create that? Yes?
It has to start with the staff that's working for kids, being motivated to make a change.
Right, if we invest in staff, they'll support potentially that change in the school environment, right? What else?
And it really is about extending the involvement of other community members in their school, in the school wellness culture, health and wellness culture that they're working to develop.
Let's get that Wellness Council to be what the Child Nutrition Reauthorization Act said it was supposed to be, right? And let's get the information that's happening at the school level reported up like it's supposed to be, right? So there's opportunities, I think, around creating that culture of health. What other strategies did you hear today, maybe not in a session or that you talked to someone else about? What were some of the other strategies you heard?
Taxing sugar-sweetened beverages.
Okay. All right. So let's talk about the model. It was originally created in 2008, 2009 with policymakers, their staffers, and subject matter experts. The Georgia Health Policy Center where I work, the reason I connected with your team is because the Health Policy Center provides all the technical assistance to rural health grantees for the U.S. Department of Health and Human Services. And your group here was one of those former rural health grantees, so I really am honored to be here. And we were one of the first states in the country to establish a legislative health policy certificate program. We had policymakers coming into their role not understanding what Medicare was, what Medicaid was, what Peach Care was, our children's health insurance program, or all the health conditions that were impacting children, children with special needs or autism, and the fact that those services were not being covered by insurance. So Dr. Karen Minyard, our executive director, who is a health policy guru, said, we need to do this, and we're going to make it a neutral, convening location. No one else is allowed in the room except policymakers and their staffers, okay? And they talk across the aisle, and they talk about how they can reach agreement on health policy. So when we're talking about systems thinking, we're answering all these different questions, like what is the issue and why is it happening and who is it impacting, right? Where is it occurring? Where? In rural areas, right? To a greater extent now, right? How is it happening, right? Is there some alignment of stars, the harmonic convergence that's happening to make this occur, right? So when we're thinking about this, we're trying to think about a systems approach that will allow us to examine how we create a more desirable future. Okay, and we do this, and I won't bore you with all of these, but I just wanted you to see, when we're talking about stocks and flows, right? The stock of a healthy, safe population, the stock of an at-risk population, the stock of a population that's afflicted by chronic disease. And everybody has the opportunity to flow and move back, don't they? If they get the right care and the right support, and if they don't get the support, they die. Right? So we have an opportunity then in the world of childhood obesity to create this collaborative model. And what we did is we brought all these different folks together. We identified a whole boatload of interventions, what we call levers. And then we started combing through the evidence at the time. Now, the model is based solely on caloric expenditure and intake. Right? That's a limitation of the model. The impact of interventions on body mass index over time. So you can imagine, knowing what you know after hearing everything today, there are many interventions that are not in the model because we haven't been able to document their impact on expenditure or intake, like farm to school and school gardens. So we went through this process. We analyzed. We looked through all this, we combed through it, and we got a lot of pushback. We started with the CDC model, right? And CDC finally got to the point they were like, we can't do this. We don't have sufficient evidence, it's really, really hard, it's just too hard to do in the model. And then we talked to them and they said, okay, you do it. Right? So the idea was for us to think about it in the context of what it really can do. It doesn't predict the future. Right? It doesn't do that. It doesn't predict. It's to start a conversation, right? What we know is that all models are wrong and some are useful. And when we talk about childhood obesity, this one is useful, and because it helps us have a conversation with policymakers and stakeholders who care about the health of children. When we first started this model, we used Arkansas data. We didn't have. The first time we used this model with legislators to test it, they said, oh, we need more legislators to see this. So when they came together in December for the legislative session starts, they played. We had all these computers with the model on it, and they got to play in it, and they got to see what happens when kids are exposed to these different interventions. And guess what? In 2009, they passed the SHAPE Act, the Student Health and Physical Education Act, requiring that all children in physical education in grades 4 through 12 will be assessed annually for fitness. We now have data annually on 1.1 million children, aerobic capacity, body composition, strength, etc. That's now being used to inform this recent version of the model where we've added some new levers. So this is what the stock and flow map looks like. It's crazy, right, when you think about it? We have a guy, Chris Soderquist. He's a mathematical modeler. He's able to visualize this stuff and create these things, and you're like, geez, this is way too hard. So let's skip over this and get right to the policy options. So in front of you, you have a handout. And I want your table to look at the list of policy options, the levers that are in the model, and I want you to decide, and you have a very short period of time to decide, right? You have to introduce a bill tomorrow on this topic. I want you to choose the one that you think will have the greatest impact on childhood obesity. I've just run the baseline for you. So the obesity percentage of children is 18%. So you have the list of, do you have the list? Oh, yikes. Rich, that is my fault. Okay, let's go back over them. So you have the levers. I want you to choose the one, knowing that you're starting at about 18%. Choose the one that you will think to have the greatest impact, and I want you to draw it, what you think will happen. And then I want you to choose 2 and draw it. What will be the subsequent line if you choose those 2? And remember, you guys, this is all for fun. Commit to a number, right? We'll actually run them in the model. So you literally have 3 minutes. Choose a policy option, decide what you think the impact will be on prevalence, and then choose 2 policy options. And you're actually going to see the model work out to 2034. Okay? 2 minutes, go, talk about it. He just made a really important point that I should have said. These levers are only levers that legislators impact the budget for, right? We can't do family interventions because they don't impact the budget. They impact transportation dollars for safe routes. They impact Medicaid dollars, right? They impact community investment in preschool and after school and in school. So these are only levers that legislators fund through state budget dollars. Okay, sorry about that. All right. I need a volunteer table. Yes?
Participation in preschool program.
Okay, so you want me to increase the percentage of kids in there, or you want me to increase the quality of physical activity and nutrition in what's happening in preschool? You can do both. Okay, so what's realistic?
In terms of
Getting more kids into preschool programs. What would have to happen for that to be funded? Okay, so let's just say you got it up to 70, all right? Not too much, right? Because it's going to be hard to get more kids into preschool. But we can get quality physical activity and nutrition, can't we? We could actually have what we call in Georgia, the Department of Early Care and Learning would actually get a policy passed that says every preschool program that receives state funding will be required to implement quality motor skill development and healthy snack programs, right, that meet the guidelines. So let's just crank that baby up to 100. We're going to be optimistic, right? Now, what did you want to throw out what you thought your percentage would be?
Not
much is what we were.
So you got 2% out to 2034, right? And you didn't get very much in the short term, but this is one of the challenges with the model, isn't it? You reported 2% change, right, in childhood obesity over that time frame, that 3-year window. And some people would say, that's not very much. Those of us working in this would say, that's a huge amount, right? And so when you tell a legislator you can get a 1% decrease in childhood obesity prevalence, right, in 2 years, they're going to be like, what? That's nothing. When in fact, when we're talking about 1.1 million kids, that's a bunch, right? So this is one of our challenges with this whole conversation. All right, let's do another one. What was another single intervention that you wanted to see?
After school.
After school. And what did you decide you wanted to do? Increase participation?
High numbers on all of them.
Okay. Excellent. We're going to do both. Okay? And then we're going to go over here and we're going to see. Let's just crank that up, right, David? We're going to take it up.
Well, you did it with the other.
That's right. I'm with you. Now, I'm going to say that you're going to be hard-pressed to get high schoolers to stay after school. So I'm going to focus on the middle school and the elementary, okay?
I think high school, but they go home and do social media.
All right. Let me just do this then. I'll crank all of those up, both the newly enrolled and the quality, okay? We're dreaming. We hope our legislators will get big dollars into after school. Okay. Now when you think about this, it had a slightly greater impact. Why?
You crank the numbers up.
More kids, right? You got elementary, middle, and high. You got more kids and more touched by a better quality intervention versus the preschool one, we're only getting those kids 2 to 5, right? Who are impacted by a state-funded preschool program. Does that make sense, right? So you guys, we're talking here about population level impacts. Much of what you heard about today is things that are happening, right, at the grassroots where we need advocates making changes. And this is what we hope you'll balance this with, which is talking about population level changes through policy, right? That can then also further the work that you're doing. All right, let's do one more that gives me both. 2.
Competitive food. Which organ is doing awesome?
You're going to be disappointed.
Preschool.
All of us, so sorry. Okay.
PE, quality.
Right, so those of you that have selected elementary school physical education, the require and the quality and have impacted classroom-based physical activity, you win the money. Why is that? 96% of kids are getting physical education. Almost 100% of kids will be impacted by classroom-based physical activity from K through 5. Just that 10 minutes a day of the classroom physical activity and better quality PE will take them to a healthier weight range, and they will start middle school at a healthier weight. That make sense? Give yourselves a hand. So, this is a computer-based model, not a web-based model, and we are happy to show it to anybody that would like to see it. And I want to explain something that we're doing in Georgia that might be of interest to you. And it's a little controversial because it was funded by the Coca-Cola Foundation. The company that contributes $6 billion to the state of Georgia, whether it's through taxes or revenue base or jobs, the first time they've ever invested, not a single Coke logo has appeared on any of the Walk Georgia or the Power Up for 30 initiative. It is, let me just say this, it is on the Walk Georgia homepage. But other than that, no other materials. Power Up for 30 is this: an administrator, a classroom teacher, a physical educator come together to be trained about integrating physical activity into the school day, before, during, after school. They have data that's collected. They answer a questionnaire, all 3 of them. They compare the results, and they talk about where there were differences and similarities. And then they create a plan for how they're going to integrate. They create their own plan. And then they're following up with them. 812 schools out of the 1,300 have signed up. We have trained 690 schools. So when you see this here, this is real, right? This is real. We have an opportunity in the next 4 years, if we can continue to support Power Up, to really make a change in the children of Georgia who are in elementary school receiving physical activity. We're talking about population level change, right? Now, where's the problem? We have a lot of health disparities, don't we? So when we think about children who are African American or Hispanic, or who are mixed race, we have a lot of challenges getting them to be more physically active. My biggest concern is the point that David made earlier about adolescent girls. So when you think about the childhood obesity model, what are some of the benefits of those strategies you saw outside of the model, like competitive foods? It has virtually no impact because in most school districts around the country, it's in high school and middle school, or only high school. And that amount that they're consuming is not enough to send them into a higher weight range over the course of the school year. Okay? So I want you to think about this. What actions will you pursue now? You have lots of grassroots efforts happening, don't you? You have some amazing work that you've heard about today. I think we're going to have to skip the physical activity, aren't we? Are we out of time?
5 minutes.
Oh, man. Can I do a physical activity? Okay. Stand up, real quick. Oops. All right, here we go. Good afternoon, class. I'm going to say a word and do a movement. You're going to do the opposite word and the opposite movement. So if I do down, you're going to do up. That's right. I want to see you bend your knees. We're going to start out slow. We're going to get faster. You need to take your hands out of your pockets because it's going to get better. Here we go. Make sure you're this far away from anybody. I don't want you to whack anybody. Here we go. Down, up, out, in, out, back, front, back, wash. we come to childhood obesity conferences and we listen and we get great information and we go back to our office and what do? Stick those notes on the shelf. Just like the school wellness policies are sitting on the shelf, right? Not anymore, that's right. So I'm going to ask you, talk briefly. What are you going to do tomorrow? What are you going to do next month? How are you going to strategize next year? I talked to a couple of folks that were working on their community health improvement plan following the community health needs assessment. They have an opportunity to take the information from today, right, and think about how they incorporate that into the priorities that the community talked about. We talked about this culture of health. We have an opportunity tomorrow to write a letter to a legislator to say, I want you to support that House bill. Imagine if everyone in this room sent a letter tomorrow. Imagine what would happen. You'd have people asking, what is House Bill 3141? And there's a lot of things we can be doing, isn't there? At the community level, we have the work of EPOD and Shape Up Somerville that's been able to bring kids into balance over a period of 3 years. We have a lot of opportunities in the school setting, but frankly, many of my friends in schools are tired of being the only point where decisions and changes are being made. So if you're going to ask the schools to make changes, I want you to be a true partner. Help them. Think about the strategies that they can embrace because it furthers the mission of the school and not your mission of health. When we first started Take 10 research in 1999, integrating physical activity with academics, it was because the school people at our childhood obesity conference said, we are not going to do one more thing to change the system. We've done virtually no social media work around childhood obesity. I should say we're not going to do it around childhood obesity, are we? Because as the woman shared earlier, it's a curse word for most folks. We need it to be about what is the behavior we would love to see families do. And I was involved in some projects a few years back with the Healthier Weight Commitment Foundation, and yes, it is industry funded. And they literally combed through 500,000 social media posts of women with children 5 to 10. And the two messages that those mothers said they were willing to do was share a family meal and do family physical activity together. Those are two messages almost anybody can get behind. Those are low conflict messages, aren't they? We have a lot of research, but we need more. Today, some of you heard about the GAPS diet for children with autism, and we heard about the issue of sugar-sweetened beverages. The folks at Harvard and others are doing systems modeling around the impact of sugar-sweetened beverage taxes. If you haven't seen their work, I encourage you to look at it. It does make a difference. But it also impacts some of our poorest families. So you have to balance that, don't you, and figure out how you manage that. Who's drinking it? This is a slightly older study from CDC, but who's drinking it? Who's drinking it? So if you're going to do this work, right, let's get some targeted work. Let's get some targeted work in the populations around these specific behaviors. Physical activity in adolescent girls, we need more work in this area. So what will you do different? As healthcare professionals, will you think about the time-limited setting within which you work? 5 to 7 minutes to counsel a family, or 15 for a well-child visit. Will you think about the work that you heard around shaming and things that kids are being told that Trace talked about? And be mindful. Use your best motivational interviewing strategies. Think about it in a time-limited setting. This is some of the work that we've done since 2002, saying, what can you do in 5 to 7 minutes? This is WIC, right? We have opportunities. And what's the hardest? Parents, right? Now, if we still had these, we'd be in energy balance. But we don't. We never had these, right? Although I think it's an awesome intervention. If I'd showed you the breastfeeding lever, the impact of breastfeeding is helpful for the first 3 years. We only have 2 studies that have showed impact on caloric. And all of the levers have assumptions documents where we document all the literature. But what we do know is routines can make a difference. Sue Anderson and Bob Whitaker published a fabulous study a few years ago. We have to think about the readiness of families, don't we? And these are low conflict strategies. If you could talk to your families about eating a meal together 3 to 6 times a week, making sure the kid is on a sleep schedule, right? So his brain gets enough rest. And limiting screen time, where we know it impacts peer-on-peer violence, sibling violence, a whole host of behaviors that parents say, I don't want my kid to do that. I don't want him to have sex at an early age. I don't want him to try alcohol in an early age. I don't want him to try a gun at an early age. All these different risk behaviors that are impacted by screen time. These are my parents. They're 89 and 88. My mom was splitting wood up until 4 years ago. My dad still shovels snow. I grew up in a town of Sinclairville, New York, about an hour south of Buffalo. I am the youngest of 6 kids, Dave, Donna, Dan, Darla, Doug, Debbie. I know. And the kids across the street were Dora, Denise, and Daniel. So when the D name is, you just answered, right? But the message I want to give you is, if you ask any of the 6 of us how come we are physically active today and how come we compost and how come we garden, it's because our parents did. Can I tell you how much I hated gardening and weeding? But I do it today. My brother Dave, who is 67, will be doing a 6,000-mile bike ride across the country, back and forth. Right? We've embraced it because our parents have been great role models. There's a great paper that was published last year about increasing the evidence to address childhood obesity. And the title of my talk, about a mile deep, inch wide, is because CDC said several years ago, we have too many interventions that are a mile wide and an inch deep. Right? They're too short-term in nature. They're trying to address the problem, solve the problems of the world on a $2,000 grant. Right? We need to know how to get kids to eat more green vegetables for a month. Right? We need specific strategies for specific populations. And the cultural piece is something we need way more work on. We need to look at this in the context of these patterns or clusters of behaviors, which is why the systems modeling work, I think, is so important. So what do we know? Successful social change comes about because there's a crisis. Do we have one? No other condition affects so many kids. We know it costs more. We have more plans than we know what to do with. So many plans. We have what? Grassroots efforts in you. We have advocates in you. And the final thing that comes about as a result, spark plugs drive social change. That is you. Children are living messages we send to a time and place we will never see. The work that you're doing today will have consequences 5 and 10 years down the road. The work you do at the grassroots level and at the policy level. And we need all of it. So as you think about when you leave here today, I hope you will think about the strategies you will embrace that will cover the gamut of state-level policy to grassroots change. It's not a rash, it's moss. You need to start being more active than a tree. 8 minutes of physical activity has health benefits. I hope you will go out and do it. Thank you for your time and your participation.